We provide a whole range of services to our citizens to help them with neighborhood issues, with personal issues. We do document shredding through the Department of Neighborhoods. We work with partners to help folks, do everything from file their tax returns to, in this case, dispose of unwanted pharmaceuticals. The City of Houston and the Houston Police Department will be partnering once again with the Drug Enforcement Administration this Saturday for National Prescription Drug Take-Back Day. I want to thank the DEA for the work they do to educate Houstonians on how to properly and safely dispose of their unused or expired medications. Unused or expired medications are a public safety issue leading to accidental poisoning, overdose, and abuse. Unused prescription drugs thrown into the trash can be retrieved and abused or illegally sold. And furthermore, and this is really important, unused drugs that are flushed contaminate the water supply. And so we strongly, strongly urge folks not to. It used to be people would say, oh, just flush your unused drugs. No, don't do that. What we want is for Houstonians to bring their expired or unused medications to one of various HPD sites. The service is free. It's anonymous. Any type of tablets and capsules or solid dosages can be collected. To find a collection site, residents can visit the DEA's website at dea.gov, where they'll find information on the various HPD substations that will be participating in this Saturday's National Prescription Drug Take-Back Day, as well as other available locations that support this effort. I'll just tell you that I have a handy list here of City of Houston drop-off locations: West Side, South Central, Southeast, Northeast, Kingwood, Clear Lake, South Gessner, North, and East Side. There's something convenient to every neighborhood, and it's a simple and easy thing to do, and something that a lot of folks just don't know what to do with their prescription medications. I'm joined here today by Charnette Lattimore, the Diversion Program Manager for the Drug Enforcement Administration. And
thank you, Mayor. On behalf of Javier Pena, the Special Agent in charge of the Houston Drug Enforcement Administration, DEA is proud once again to be in partnership with both Mayor Parker and her office, as well as the Houston Police Department. As the Mayor said, there will be a National Take-Back Initiative this Saturday on the 27th of April between the hours of 10 and 2. There are approximately 38 locations within the City of Houston where residents may drop off their pharmaceuticals, no questions asked. Merely see or visit www.dea.gov for the location closest to your members. This is such an important initiative because in 2011, 6.1 million Americans abused pharmaceuticals. 20,000 individuals succumbed to overdose deaths as a result of pharmaceutical drugs. In the absence of the National Take-Back Days, members should know that there are 3 permanent take-back locations within Houston area, the metropolitan area. Harris County District 2 has a permanent drop-off, again, in the absence of the National Take-Back Day. Again, on behalf of DEA, Mayor Parker, Assistant Chief, thank you so much for your continued support of the National Take-Back Program.
I'd like to thank the mayor and the DEA for hosting this public safety prevention program. What this is going to do, it's going to prevent children from gaining access to prescription medication. It's going to prevent accidental overdoses. It's going to prevent intentional abuses of prescription drugs. So I'd like to invite everybody to take advantage of this opportunity. Go to one of the nearest police stations or drop-off points. Simply walk in, place the items in one of these containers. There's no questions asked, and it should be quick, easy, and it will be good for the city. Thank you.
Sorry, I should have introduced you. That was Assistant Chief George Bunick, and this is not just for what we would consider dangerous drugs or narcotics. This is for unused medications in tablet form or a solid dosage. It's a great excuse to go through your medicine cabinet and collect things that have expired. You know you have them. Don't try to deny it. Everybody here has stuff in their medicine cabinet that should have done something with a long time ago. Bundle them up, throw them in a paper bag, and take them down to one of the drop-off locations, either the police stations or, which I believe, ma'am, you said 38 locations across the city of Houston, the greater Houston area, so there'll be a way to dispose of your medications. Now, it's easy. Doesn't matter what kind of medications, old antibiotics, you should have taken all your antibiotics, but old antibiotics, pain pills, right in the box. Easy to do. I'm looking at this one. This is not in pill form. This is an ointment, so I'm not going to drop that one in. Easy. Thank you. Anybody have any questions? Great, thank you. Now, a couple of quick items. Wanted to update you guys on the progress of our DNA backlog clearance, the so-called sexual assault kits. The end of February, we approved the plan and contract with 2 DNA providers to take everything we had and to begin the process. Pleased to report that everything is out of our hands and is in the hands of Bodie and the Sorensen Laboratories to be tested. All cases that were awaiting DNA testing have now been sent out, and the testing process has begun. So while not everything is through the testing process, there's nothing sitting on a shelf anywhere in the city of Houston. It is all in progress. The cost of the outsourced testing, $4.4 million. Half of that is covered by National Institute of Justice DNA backlog grants that are offered to a number of cities, and the other half came from general fund monies that we set aside when we created our new Houston Forensic Science LGC with the intention of dealing with the backlog. We're on track. We're very excited that all of the existing cases are in the hands of the testers. Within the next 60 days, production reports should begin to be available, and we'll just start rolling them out. But we're on track for that